Welcome to Pharmacology Outline channel. In this video, we will explore different types of drug ligands. Drug ligands are molecules that bind to specific receptors or targets to elicit a biological response. 1. Agonists. Agonists are ligands that bind to receptors and activate them to produce a biological response. They can be full agonists, partial agonists, or superagonists. Full agonist. Full agonists bind to receptors and activate them to produce the maximum possible biological response. For example, methadone fully activates opioid receptors, providing pain relief and used in opioid addiction treatment. Partial agonist. Partial agonists bind to receptors but produce a submaximal response compared to full agonists, even when all receptors are occupied. For example, varenicline, a partial agonist at nicotinic acetylcholine receptors used for smoking cessation. Superagonists. Superagonists produce a greater response than the endogenous agonist when binding to the same receptor. For example, goserelin, a superagonist of the GnRH receptor used in prostate and breast cancer treatment by initially stimulating and then downregulating receptor activity. 2. Antagonists. Antagonists are ligands that bind to receptors but do not activate them. Instead, they block or inhibit the action of agonists. There are two types of antagonists. Competitive antagonist. They bind to the same active site on the receptor as the agonist. They are essentially competing for the same spot, consequently prevent the agonist from binding to the receptor, thus blocking its effect. For example, naloxone binds to opioid receptors, blocking the effects of opioids and used to reverse overdoses. Non-competitive antagonist. These antagonists bind to a site on the receptor that is different from the agonist's binding site, an allosteric site. This site can be on the receptor itself, or very close to it. By binding to this alternative site, the non-competitive antagonist changes the conformation of the receptor in such a way that the agonist either cannot bind effectively, or if it does bind, it cannot activate the receptor properly. For example, ketamine blocks NMDA receptors. It is used as an anesthetic. 3. Inverse agonists. Inverse agonists bind to the same receptor as agonists, but produce the opposite effect by reducing the receptor's basal activity. For example, beta-carboline acts as inverse agonist on GABA receptor and causes stimulation, increases muscle tone and convulsions. 4. Allosteric modulators. Allosteric modulators bind to a site on the receptor different from the agonist binding site and modulate the receptor's activity. They can be positive or negative modulators. Examples: positive allosteric modulator. Benzodiazepines enhance the effect of GABA at GABA-A receptors, used as anxiolytics and hypnotics. Negative allosteric modulator. Maraviroc binds to the chemokine receptor, 5-CCR5, and inhibits HIV entry into cells. In conclusion, understanding the different types of drug ligands and their mechanisms of action is fundamental for developing effective pharmacological treatments. Thank you for watching. If you enjoyed the video, please like and subscribe for more pharmacology insights. Hit the bell to stay updated. Keep learning.